Hi, Sonal. Great to see
Hi,
you today. Yep, yeah. So
thanks
I
for having
would
me.
like to introduce Dr. Sonal Shah. Uh, she has just joined us to become our Director of Pediatric Dermatology for the Department of Dermatology and for Rainbow Babies and Children's Hospital and the Department of Pediatrics. A lot of things there. So Sonal, welcome. Where did you come from and what drew you here?
Thank you. Yeah, thank you for having me. So I previously was out on the West Coast. I was in San Francisco at UCSF, where I had done my pediatric dermatology fellowship and then stayed on faculty for a few years after that. And there were a few reasons that I was drawn to UH and to Rainbow in particular. Number one, I'm local. So I grew up in Cleveland. And so my parents are still here. So it was very alluring to have family close by, especially after being on the West Coast for so long without that. And then the second thing that was really unique about this position was the opportunity to build a division of pediatric dermatology in such an amazing children's hospital. I felt like it was really a gap that was missing in terms of care that we could provide to patients. So having that just sort of mission of building and creating something and really leaving a mark, I think was very, very unique and an opportunity that I was excited about.
Yes, and we were very excited also that this is not your first build, right? You've built a pediatric dermatology program from scratch before.
That's true. Yeah, right out of fellowship, actually. So while I joined faculty at UCSF, my initial position was to create pediatric dermatology at Children's Hospital of Oakland, which had just sort of been merged with UCSF Benioff Children's Hospital. So I did have some experience before. I'm a little bit wiser this time around. So I definitely knew what pitfalls to avoid. So I think it's going a little bit smoother than before, but I did have some experience in that. So it was not a daunting task. It was actually one that I really welcomed.
Yeah, no, it's been a pleasure working with you, knowing that you've done this before and you've been around the block and not your first rodeo, as they would say, and trying to, accomplish something like this. And it's gone very well. How is your experience so you're set up seeing peds, derm patients in the Department of Pediatrics
Yeah.
in Rainbow. How's that going?
So it's actually been great. I think I finally feel settled. We have been busy from the start, so that's always exciting. But yeah, right now I'm working just in the pediatric multi-specialty clinic on main campus at Rainbow Babies. So that's also been lovely because I've been meeting a lot of other pediatric subspecialty providers. So, we're sharing patients back and forth and we're having nice banter kind of in the workroom. So that's been great in terms of building relationships on the ped side. And we have the residents working with us, both the derm residents and the pediatrics residents. So that's always been a joy of mine is teaching. So it's been wonderful to have them. And I think they are enjoying the rotation and seeing pediatric patients and becoming a little bit more comfortable with pediatric skin disease. So I think things are going great.
Yeah, no, our residents are very pleased and it's great, great opportunity for them. Definitely, like you said, it's been a gap for us and we're so pleased to have you, on board. And, we see some incredible cases and we know these are going to be very, very good academic cases, great teaching cases. And we're looking forward we're committed to hiring more pediatric dermatologists into our program and looking to become a preeminent program under your leadership.
Oh,
So
thank you.
thank you very much for joining us and for the interview.
Thank you.